Very good afternoon to everybody, and thanks Chetra for inviting me for this course. I do have financial interest. I'm a consultant for ODOS, which actually makes this Nevilas, and I have got travel support from Allergan. To start with, as Chetra has already briefed us about the laser photocoagulation history, and we all have seen the growth starting from 1956, which started with xenon, and then we had Pascal in 2005, and now in 2009 we have Nevilas laser. So to start with, as Chetra has already briefed you up about that, we have some three options at present: 514, 810 and 532. The pulse duration, which is typically with a conventional laser system, is between 100 to 300 milliseconds, and spot size is around 50 to 500 microns. But if we really look at the limitations of this conventional laser system, we see the patient is very uncomfortable. This poor lady is actually pretty much uncomfortable because there is a need of contact lens and anesthesia. You really have to struggle with the live fundus view with a small slit, and we are not sure about the accuracy, and for the beginners it is a challenge because of the lateral and upside down orientation, and because of which sometimes you end up hitting at the wrong places, and many a times the patient are very uncooperative for this bright light which we use in conventional laser. So there have been struggle to improve the patient experience or the compliance in terms of reducing the exposure duration, avoiding the bright light by using red or infrared wavelength, and decreasing overall treatment time. In the same manner, Pascal laser was introduced in 2005. We all know about this. This is a pattern scan laser. The biggest advantage with Pascal laser is it basically is a shorter pulse duration. If you look at the histopathology of this two eyes, this is a conventional laser and this is a Pascal laser, where we can clearly see that the collateral damage is less and the damage to the choroid is less, which eventually leads to the decreased pain for the patient, with almost expecting the same outcome clinically. However, what was still unaddressed with Pascal laser? Patient still has to bear the bright light. We still had to use the contact lens. We were still lacking with our planning, and we were still confused between the upside down and lateral orientation, and therefore we were not pretty sure about our accuracy. That is where the Nevilas plays a bigger role. It is basically a navigated laser photocoagulation, which is now approved by US FDA as well as European Society. So what is Nevilas? Nevilas is the same laser of 532 nanometer, that is frequency double solid state laser. It has three components: color fundus photography, fluorescein angiography, infrared imaging, along with the laser photocoagulation. And if you look at the spot size is very wider range, ranging from 50 to 5,000 microns, and the pulse duration is 10 to 1,000 milliseconds. So basically it is a fundus camera based. It is not a slit lamp. That's why you really do not need a slit lamp. You do get a live fundus view on the computer screen, and the most of the view what you are getting is basically reflection free, and it allows you the treatment in infrared wavelength. These are the couple of bigger advantages of Nevilas. So what are the steps of performing laser using Nevilas? The first step goes with the image acquisition and planning and treatment and the documentation. So the next video I'll be covering all these four, which is just to show how the focal laser is being done. So at this stage we are taking a color fundus photograph. This is the infrared view, and this is how you get your photographs here. And this is the same time we are doing the fluorescein angiography of both the eyes. You can see the live view on the computer screen. And this is how you start the planning. This is a foveal avascular zone blocker. Then once you have blocked this area, then you can go ahead and just mark these microaneurysms. And the great part about this system is that you can actually pretty much customize the laser burns for each microaneurysm, ranging from the spot size to the pulse duration for each. In fact, you can modify it during the treatment and try to see how your laser burns are coming, and you actually get a small insert during the treatment to understand whether your laser is working, giving a good burn or not. So you are seeing that I'm actually modifying each spot. This could be a time-taking you must be thinking this is a pretty time taking, but you just think that you are actually going to do a pretty much customized laser. And now this is the live fundus view where I have not put the contact lens and patient is moving, and because of the eye tracking you see the laser is also moving. The laser spots are jumping to the next one on their own. I just have to press the foot pedal. And if the patient suddenly moves, this laser stops automatically. We'll come to the questions later.
Okay.
Let me concentrate on videos. I'm more worried about the Mac videos. Okay, so what are the advantages of Nevilas? Color photographs and fundus fluorescein angiography and the laser on the same device. It provides us the computer-based laser planning, and we saw the safety and the eye tracking using this system. So let's look at each of these aspects and with the literature of how we have supported this system. So when we look at the accuracy, this was one of the earliest paper which we published from San Diego, and we reported that there is a 92% of accuracy as compared to the conventional laser while using Nevilas for focal lasers. And if we look at the patient comfort, then the laser treatment is being done in infrared wavelength. That's why there is no need of contact lens and patient is very comfortable. You can look at this picture of Pascal, the way I'm holding the lens, and if you look at the Nevilas, you are seeing that patient is very comfortable. There is no contact lens. I don't have to bend. I am just looking at the computer screen and I'm performing the laser. We analyzed these aspects of treatment pain in, comparing Nevilas in focal and PRP treatment. This focal paper was from Germany, which you can see that there is a significant difference, and this was the study which we performed at LVPI, and we reported that the treatment pain is significantly less compared to the conventional laser. How about the physician? We are talking about the patient till now. How about the physician? We have a live fundus view on the computer screen. We are not confused with the orientation. There is no inverted or reversed image, and we can easily toggle between the color and the infrared image, so our life becomes much easier. The biggest advantage which I find is the multimodal image integration. That means if you want to use a ICG, the patient has got their FA done from outside, you can always put a USB stick on which you have your images, and now you will be seeing that I am now using OCT and overlaying it on the fluorescein angiography which we have performed on Nevilas. So in this, at this point of time, we will be utilizing the information which is coming from the fluorescein and coming from the OCT, and then deciding the laser treatment. As you can see, this white area means the thickening is much more. So now I'm going to put the laser marks here and combine my laser planning which I have already done on fluorescein. And the same way we can actually modify the whole thing and combine the information from both. And similar way, we can utilize autofluorescence, you can utilize ICG, fundus fluorescein angiography. Even if it was done outside, you can bring in the images, put it in the integration mode, and you can, this is how you actually use the information from different imaging modalities. So we did a study utilizing this information from OCT, and we reported that there was a significant increase of almost 40% of the marks which could be added if you are using the OCT macular thickness, which we were in fact losing on when we are utilizing only fluorescein angiography. What is the another advantage? This was the paper which we published recently, in which we actually performed a single laser mark for the CSR cases. You can see that this is the leak which I have done a single laser spot, and this single laser spot actually led to the complete resolution of the fluid, which we all know. But in a conventional laser, we might have put around 3 to 4 spots to that laser, to the leak. But with Nevilas, because of the accuracy and the laser planning, you can just do a single spot, and this is how you save the energy delivered to the retina. Now look at the PRP with Nevilas. This is something which is a pretty new thing which is coming up. If we look at the PRP, we can see that you can actually perform the more complete treatment. This is a single image. This is not a montage. With the wide angle lens, for PRP, we really need to use the wide angle lens provided by the company, and this lens gives you almost the complete view of the retina, and you can complete the PRP in single sitting. Because we are using a navigated method even for PRP, you can complete the laser treatment much faster and much more comfortable. This is one of the videos where we are showing that I'm performing the laser in bright light, and you can see these spots, and you can actually see where all you have already performed the laser. If your patient is very uncomfortable with the bright light, you can actually use the infrared light as it is seen in this video, and you can see that how I would be able to know where all I have already performed the laser to this eye. And patient is very comfortable because of the infrared light. So we performed the study in which we actually compared the PRP laser done by Navilas on the conventional laser for PDR cases, and we reported that Navilas eyes led to less neovascularization, and the spot variation was much less. They were more circular or uniform. The patient reported less pain and less treatment time in this Navilas laser. The beauty of this Navilas is this, where because whichever treatment you are doing, at the end of it you do get a documented report like this, in which you can actually see what was the laser parameters used and where exactly you did the laser. And this is a very useful information, especially nowadays when we are moving towards the sub-threshold laser. We really don't know where we have done the laser in sub-threshold, but if you look at the report, you will know where exactly you performed the laser last time. Another biggest advantage is that, sorry, I had to take this picture from the company. I could not take a photograph for our fellows. So this is one of the beauty of this Navilas, that you can actually show your fellows where exactly you are doing the laser. We all have been just looking through the side view, which I really never knew where my consultant is doing the laser. But with the help of Navilas, we actually know where exactly to do the laser, what is the appropriate laser burn we are looking at, and you really don't have to worry. Your fellow is doing, you can stand beside and you can see how good they are performing. So other aspects of Navilas, if you look at the cost effectiveness, I know it is a pretty expensive machine, but if you really combine all the investigations, FA or color photographs, and especially the office space nowadays is the biggest crunch. So I think it's a pretty cost effective manner, and you really don't need to keep 3 technicians to handle your 3 machines. Another thing which has started, we have just started with the microsecond laser using Navilas, in which we actually perform the laser outside the required area, and you can see that we are performed. This is not the video which I have performed, but you can actually do a confluent laser in this nice manner, and everything gets documented very well. So just to conclude, that what benefits Navilas has given us is the computer-based laser planning, eye tracking, and it's a pretty accurate machine, and multimodal image integration, and patient comfort, treatment ease for the physician, and efficient PRP, the well-documented report, and a laser training. Thank you very much for your attention.